Hi everybody and welcome to the Newmark Winter Health Services webinar. Just a bit of a quick introduction to myself. So my name's Lucy Morris. I'm the Patient Services Manager within the Patient Services team, and the Winter Health Services webinar today should last about 30 minutes. So I hope that's okay for everybody. With regards to the objectives and what I hope you'll get out of today's webinar is we'll be providing you with an overview, a very top line overview of just thinking about some of the health considerations over the winter period, and then looking at thinking about that, how community pharmacy can support that from a private services offering. And we're going to be focusing on three key areas, so vaccinations, winter health vaccinations, so flu, pneumococcal, the sore throat test and treat service, and looking at minor ailments. And then just to finish it off, we'll just direct you to some key resources and further reading that you might find useful to help you think about the services and which you should be setting up and how you should be setting them up. So winter health. As I put down on there, there's been quite a few studies that have been done looking at the different illnesses, ailments that kind of increase during the winter season. And studies have estimated that between 5 and 13% of consultations for minor ailments, so 5% through emergency departments and 13% through GPs, they could actually be managed within a community pharmacy. And it's drilled it down into recognising that there are four key main areas, and those four areas being upper respiratory tract related minor illnesses, musculoskeletal pain, ear-eye discomfort, and gastrointestinal disturbances. So they're the four of those minor ailments that actually could be managed within, or believe could be managed within community pharmacy. So if we think about winter, you know, as the nights start drawing in, the days get colder, that's when local healthcare professionals, so pharmacy GPs, start to see this increase in this wanting support, wanting advice for these illnesses, these winter related illnesses. Now, interesting, every year there is the self-care awareness campaign that is launched, and the intent of that self-care awareness campaign is to encourage those people to understand that actually, yes, they have these minor illnesses, but just to think how they can keep themselves healthy during those season, or manage them effectively during that season. Just for information, so looking at the self-care week for this year, so it is going to be the week 15th to the 21st of November. So there will be quite a lot of resources that will become available during that period to raise that awareness to your customers. And actually, you could think about there'll be a link to use those resources to link into if you are providing any of these private services that we're going to discuss. And again, just another little bit of interest, that there was the PAG B report, so the 2020 report, that actually identified that when they'd done some research, the pandemics potentially made people think differently about utilising pharmacy, because we know it's a healthcare professional that was easily accessible, open, when there was probably quite a few of our other healthcare professional colleagues who weren't as easily accessible during that period of time. So following on from that, it's found that 34% of people who before the pandemic wouldn't have consulted a pharmacy said that they were more likely to now after the pandemic, or as we come to the end of it. So again, just something to think about, that people are actually recognising community pharmacy as that go-to place. So it's a real opportunity to maximise on that. So thinking about winter health and thinking about those minor ailments, it really brings to life the fact that community pharmacy is ideally placed to improve the accessibility to customers of the treatments, of the advice, and even more so at this time when we know it's increasingly difficult to obtain an appointment with GPs, especially for minor ailments. Yes, community pharmacy has a significant range of OTC products and advice that's available currently, but there is this opportunity to build on it with PGD. So being able to make that supply of that prescription only medicine via the PGDs without the need of having to direct those customers to their GPs. Also under the PGDs, potential opportunity of, although it's offering those consultations in pharmacy, extending it further via telephone, video conferencing facilities, which has become more acceptable with customers over this period because of the pandemic. So again, how can you build on that? So working in partnership with PharmaDoctor, we give members access to a wide range of those private PGDs, and as I put down on there, members are also eligible for a discount on what the standard PharmaDoctor price is. So if you go and look in the PharmaDoctor offering, just be aware that that's standard pricing that they offer, and once you log into the system, it will recognise the pharmacy as a Newmark pharmacy and therefore will offer the discount on that price. But thinking about those PGDs to support a winter service or winter health service, benefits to the pharmacy. Yes, it's additional income, additional profit. Additionally, professional fulfillment. You are being able to provide that clinical service, making that supply of that prescription only medicine to that individual. Drive footfall. Hopefully it will have a wider halo effect on the offering within that pharmacy when people come in to access that service. And it just continues to drive that recognition of community pharmacy as that accessible healthcare professional within the community, being able to support more broadly, not having to just direct back to the GP. Looking at the wide range of the PGDs that are available through PharmaDoctor, these are the 6 that possibly fit into that winter health kind of category. So flu pneumococcal, sore throat, ear infection, nausea and sickness, pain, so back pain, migraine, and acid reflux. So I'm just going to touch on some of those in a bit more detail and direct you to some of the resources that are available from Newmark to help you consider the opportunity and also to support you to set it up. So flu and pneumococcal vaccination services. If we look at last season for the flu vaccination service, community pharmacy administered over 2.5 million vaccinations under the NHS vaccination service. We do know that many pharmacies also extended their offering with a private flu vaccination service. Not all, but many did, extending the use of that skill that they've developed as part of the NHS service, but also continues to increase that recognition as a vaccination centre and driving people in who potentially do not know where else to go to access a private vaccination because they recognise the benefit of protecting themselves over that winter period. But this is where there becomes that increased opportunity to extend that vaccination offering to include the pneumococcal vaccination service. With COVID, with the pandemic, we've been hearing a lot about respiratory, we've been hearing about pneumonia. So actually there is a lot more almost awareness of the potential need to protect yourself through having a vaccination, of which flu is obviously one, but pneumonia, so the pneumococcal vaccination is another. So as I've said, through PharmaDoctor, we make available the PGD. It supports the supply of the 2 vaccines that I've listed there, so the Prevnar and the Pneumovax. Now, what within Newmark we've done is developed a range of resources, so service support pack, SOP, checklist, a significant number of materials just to support that setting up of that private flu and pneumococcal vaccination services. So I put down there the link on Newmark.net, which will take you through to the hub page, whether it's the flu service hub page or the pneumococcal service hub page, of which of that there will be the resources that you can access and download and hopefully answer a lot of the queries that you may be thinking at the moment. So go and have a look at those. Sore throat test and treat service. Again, looking at some of the statistics of studies that have been done. So approximately 1.2 million visit their GP for sore throats during this winter season. Now, most are due to viral infections, whereas we know symptomatic relief is the only treatment, and OTC products and other products are available from community pharmacy. But we also know, as part of those consultations where it may be a viral infection, that customer may also be made a supply of an antibiotic which is inappropriate, and as part of the antimicrobial guardianship, isn't the best solution or best treatment for that individual. So thinking about the position of community pharmacy offering this service, ideally placed to help customers identify if their sore throat is viral or due to a bacterial Streptococcus A bacterial infection. Depending on the result of that, actually that's when an appropriate supply of treatment, which, as we say, could just be for symptomatic relief, or it could be providing an antibiotic treatment via that PGD. So it's really a really beneficial service for those customers to ensure they get the most appropriate treatment. The PGD itself, you can make supply of penicillin tablets, penicillin solution, or clarithromycin, whichever is most appropriate for that individual. The other thing through PharmaDoctor, which is available when you go look at their sore throat service offering, is the actual test kits themselves. So they are very much like the, I suppose, the COVID ones that we're all well aware of now. Similar thing, and Newmark has developed a range of resources to support the setting up and delivery of this service, including taking a throat swab, which a lot of people will be significantly more familiar with that process now, but taking that throat swab, how to conduct the test, the interpretation of the tests, and then also the supply of the appropriate treatment, which could be the antibiotic into the PGD. So again, service support pack, some material, marketing materials, SOPs. The link there will take you to that hub page for the service, which will then allow you to access all of the resources available. So thirdly, the minor ailment service. We, on the slides previously, we mentioned the fact that there are those 4 areas for minor ailments, of which 3 of them listed below here, but accounting for that 13% of GP consultations. So musculoskeletal pain, eye, ear discomfort, and gastrointestinal disturbances. And as we've said before, those customers are much more likely now to be thinking of coming back into pharmacy for advice on those minor ailments. So it's a great opportunity for community pharmacy to almost complement that OTC offering with this wider range of private services. So giving those customers much more choice to support them appropriately. I've listed down on here the PGDs available to support the supply of the ear infection, nausea, vomiting, back pain, acid reflux, migraine. I'm not going to go through all of the individual products because you can obviously see them all there. But what I'd probably look to direct you to is the fact that all of those PGDs are actually offered through PharmaDoctor. They can be purchased individually, but also PharmaDoctor offer the minor ailments clinic, which I put the link on that screen. Within that minor ailments clinic, there is all of these PGs. There are some others within there as well, which are not specifically directed towards winter, but you may want to look at those, and actually you may find that buying the bundle with all of the PGDs in is a much more effective way of doing it than purchasing each one individually. But the link's there. Go and have a look. Actually look at the full range of offering as well, because you may find some that you think would benefit you over and above the winter health services. So just thinking about the resources, I've talked on some of the slides about the specific resources around those specific services, but what we've also got on NewmarkNet is a winter health services hub page. So that's more a general overview and links into a wider general assets and resources. So I've put the website address on there for you to access, but just listed some of the resources on there. So downloadable posters for the different services, social media assets, so really giving you some marketing tools that you could use within potentially your current social media network that you use, but some assets to utilize as part of those communications. Profitability calculator. Now, I know we've talked about all of these services. I know we've talked about it generating additional revenue and profit. You're probably thinking to yourself, well, what could it generate? How do I kind of estimate the type of profit it could generate for me? So the calculator itself is an interactive calculator. So when you download it, what it will ask you to do is to think about what you'd want to charge for the service, because you know if you've got competitors within your area offering something similar, you obviously want to be competitive. So put your own retail price in there. You can put other prices in there like staff costs, and it will then ask you to estimate how many customers do you think you could get. So again, depending on your demographics, you may have the feel for, you could get potentially 10 customers each week during the winter season. You might only get one, but just by putting in those different variables, it will estimate to you the level of revenue and level of profitability. So will help you think whether it is a viable option for you. And the other thing that it links you to is health promotional activity resources. We talked about the self-awareness campaign, but actually you might want to do a winter health service campaign within your pharmacy to really highlight the offerings that you've got, whether that's OTC, whether it's private services, just to kind of get those customers thinking about how they can support themselves through that period and how you within the pharmacy can support those individuals. So go and have a look at that. There's lots of resources on there. The other hub page directs you to is the private services hub page. We're talking here about winter health services, but actually there are other services you might want to consider looking at. So weight loss service, ED, hair retention services. There's a number of them which, again, resources available that you may want to look at. You can use a profitability calculator for exactly the same reason to look at whether they're viable for you. But that private services hub page kind of takes you in at the top and lets you think about the different opportunities that are there. And the third bullet point I've got down there is the information services. Fantastic resource within the team that if you are delivering a service and you have some clinical queries around some of the aspects of it, our information services team is a great resource to use. So I put down on their telephone number, but also an email address, just in case, you know, you might have some queries in advance that don't need an urgent response. So please use that resource because they're a great resource to access. And I've also listed down on there three references, because throughout the documentation, some of the statistics that I've quoted, they're the references to them in case you want to go and have a look and interest and see more of the detail behind that. So I'm hoping you found that webinar useful to give you an overview of the potential opportunity to extend or support the winter health with these private services. What I want you to think about is actually, having now completed this, complete a post-webinar commitment sheet just to help you think about what you can implement or how you can implement some of the key learnings from this session today. So we've created those post-commitment sheets for you. They are downloadable via the Newmarch Training Library, which I've put the link on there as well. So if you want to access them and download them, please do. And I know some of you may want to actually use this evidence as part of your CPD. So there will, after you've closed this webinar down, there will be a short quiz at the end just to test your knowledge, and a certificate that you can print off or keep electronically that is available to use if you want for your CPD. So lastly, just to say thank you for the time just listening to this webinar. If you've got any queries or anything you think about once you start potentially setting up these services, I've put the email address there to the service development team. So please drop us an email with any questions, queries, suggestions to that email address, and one of the members of the team will respond. So I hope you found it useful. As I say, any queries, please drop us an email, and thank you very much for your time.